Welcome to ADEC's In Conversation special series addressing COVID-19. I'm your series moderator, Dr. Jill Harrington, coming to you from the Washington, D.C. area, our nation's capital. We also have Mr. Isaiah Allen, Executive Director of ADEC, coming to us from Minneapolis, Minnesota. Today we welcome Dr. Darcy Harris, who's a fellow in thanatology and an associate professor and thanatology coordinator at King's University College at Western University in London, Ontario, Canada. Dr. Harris is also the lead author and editor of Principles and Practices of Grief Counseling, first, second, and now third edition, offered by Springer Publishing. And Dr. Harris is also a member and leader at ADEC, who's going to be doing an upcoming webinar on Tuesday, April 21st, addressing grieving the loss of living our lives. So for more information after this talk today, please check out ADEC's professional education for the webinar she'll be doing on Tuesday, April 21st about grieving the loss of living our lives. So Dr. Harris, thank you so much for joining us here today.
Thank you for having me, Jill. Thank you.
I know you're one of the leaders and pioneers in our field about educating people about non-death losses. So I just wanted to start out today to maybe ask you to explain to our audience, which are primarily ADEC members, and they may or may not know this, we don't want to assume that, and also the general public, because in most of the conversations I've been having at ADEC and conversation and stuff I'm reading and articles and interviews I'm listening to, a lot of people are talking about what we would consider non-death losses that are happening during COVID. So I thought maybe you can help educate the audience a little bit about that.
Thank you. I think for many people, grief is, and rightfully so, seen as the response to the death of a loved one. And that's very much the case, that we do grieve when we lose a loved one. But we also grieve the loss of other parts of our lives and events that happen that I say you can't return back to the way things were. I go to what we call the assumptive world construct, and that each of us has a way of seeing the world. It's kind of started when we were young, sort of when our early attachments got formed, and how we actually see the world, how we expect things to be, how we see ourselves. And that kind of gets us through on a day-by-day basis. But what happens is there are times in our lives where events happen that the assumptive world we have, the assumptions that we make about the world, don't make sense. That somehow how I expected the world to be, or how I thought others would be, somehow is violated, and it doesn't fit the situation that I'm now entering into. So the premise here is that yes, grief results from the death of a loved one, but it also is the death of our assumptive world. So that when one of our assumptions, or all of our assumptions that carry us through on a regular basis no longer work, we grieve the loss of the world as we once knew it. And we grieve the loss of ourselves as we once thought of ourselves, of other people in the way that we thought of them as well. So grief to me is an all-encompassing experience that may include the death of a loved one, but really can include all types of loss experiences as well. And I think we're seeing that now very poignantly as we look at what people are describing their losses right now from the experience in the pandemic.
What kind of losses are you observing?
There's lots, and probably the people who are watching this conversation would have their own list, but certainly the idea of certainty, the loss of our daily lives. I mean, how many of us are having to now work from home, school our kids at home, looking at the financial implications of what's happening with people losing their jobs and the financial insecurity. We can't connect with the people that have always been part of our lives and support systems in the same way. We're isolated in that sense. So, and that's just to name a few. There's also, the uncertainty about health and about our healthcare system and the sustainability of some of the practices that we've taken for granted up to this point. To be honest, there's a whole lot more that's not the same than what was the same. It's amazing the difference a couple months can make in terms of how we see the world and how our lives have now changed drastically for many of us.
Do you think non-death losses sometimes can be a little bit more disenfranchised than a loss related to death?
Absolutely, because it's something that's almost subjective to the person. Grief is not resulting from a cause. Grief is resulting as a response to loss, no matter what the cause. And so it really depends on the person with the loss and how they interpret that experience. So one of my students, his dog died recently, and he said, I was devastated. And he said, now my grandmother died 6 months ago. He said, I hadn't seen her that much. I wasn't that close to her. I felt sad. But when my dog died, I was completely non-functional. So I think non-death losses make us highlight how subjective grief experiences are. And so it makes it difficult to measure them and to validate them. So instead of validating an event that happens, we have to validate the subjective appraisal of what has happened and the person experiencing it. So we have a more difficult time with that because that's iffy. That's more, that's less defined than an actual event of, say, a loved one dying. So we have to open ourselves to think about a subjective interpretation provides the validity of my grief reaction versus an actual event that I can actually measure and see concretely.
It's such an interesting observation. I've had two clients in the last 24 hours, both in their, I would say, late 20s, and both having two differently subjective experiences to the COVID quarantine. One of them who is, she's grieving the loss of her, basically her routine, all her social interactions, her ways of coping with her anxiety, not being able to go to the gym, the distractions she uses in life, the social interactions, being part of her workplace. And then I have exactly different parallels, same person around the same age. I wouldn't say same person around the same age. He is very happy to not be commuting to work. He is changed. He has a little more, he feels he has more control over his life because he can log on when he needs to for his work, because it's not like he needs live interaction. He's getting more physically in shape. He's connecting more with friends. And so just within 24 hours, the two totally different responses based on their subjective experiences. And one would say that he may have been experiencing losses, but to him, they were gains. And to her, they were losses.
Yeah. And that's a key point, is this that subjective interpretation. And, you know, because it's subjective, it's sometimes brought into question that we want validation by measurement, or we want validation by a checklist. And that doesn't necessarily work in non-death loss experiences. So, you know, and we also don't compare losses and think about, well, this grief is going to be bigger than that grief, because we don't know. Lauren Breen and some of her colleagues in Australia did a research experiment where they asked people in general public to rank specific types of loss experiences for how much grief they should produce. And it was interesting how people assumed that based upon this experience, you'd have this much grief, and this experience, you'd have that much grief. But if you then go to the lived experience of people, you know, who went through these experiences, I'll bet you come with a completely different scale of how people interpret, and it would be all over the place, because each of us interprets events very subjectively, very much based upon what they mean to us, what they rob us in terms of our meaning and our identity, and how significantly they're having ripple effects through other parts of our lives.
Yeah, that client I mentioned, the one who said that he recently lost his husband in the last like 9 months, and one of the gains he's having, not having to go into work, he feels, is not having to put on that grief mask, as he called it. So he's really feeling a lot of relief from that. So you've said a lot of important things about appraisal, subjective experience, but what would you say are some of the non-death losses that you are really seeing that are really affecting people with COVID-19?
The big one right now probably is financial. I'm seeing that with a lot of people. It's affecting across the board, almost everybody, even if they're not self-employed. For example, I work at a university, and we're having budget meetings now to address shortfalls in enrollment that we're expecting, because international students will not be able to come into the country in order to come back for their programs of studies. And so they're talking about cutting classes, cutting out faculty members who are part-time, reducing compensation for teaching assistants and teaching program, asking faculty to teach more, and that's part of it. For the people that we come in contact with who have had to close their restaurants, my husband goes every morning to his neighborhood diner, and he knows the guy is this old man. He's been running this restaurant for 30-something years, and he just looked at me and said, if they close me, I don't know what I'm going to do. And so you wonder, I mean, we have these economic packages that are coming, and Canada is no exception. We've had huge economic packages for people who are self-employed, people who are falling between the cracks, for generous access to unemployment insurance here. But there's so much uncertainty about what's going to happen financially. And of course, you think about the three big ones, your finances, your health, and your relationships. Those are the three big areas, I think, that probably have the most impact on us. And there's not a single one of those that has not been profoundly affected, either by social distancing, by quarantine or closures, by being a non-essential business. So you think about every part of our lives is being affected in these three key areas. And so you really have to stop and think, wow, this is all encompassing in so many ways. And the tangible losses, obviously are, I don't go to work regularly. I don't see the people that I'm used to coming in contact with. I don't get to go out and about. I'm pretty introverted, and even I'm having a little bit of, itch that I'm going to go for a drive in the car. It's just, but
that's a chosen.
Think about that.
Chosen, not a mandated one, right?
Yeah, that's right. So it's one thing if I choose it. It's another thing if I don't have a choice. And I think that's the other piece, is the inability to choose our daily pattern and to choose where we go and what we do. And then this is an uncertainty. You can't see a virus. It's a threat. It's something that's out there, but it's invisible. And so it's not something that I see people who are infected are purple. And so it's one of those things that it's invisible and hard to find and hard to see, but it's everywhere. And so there's that real sense of ominous presence of something that could be really devastating. And I'm stuck at home trying to work off my computer. So there's that real sense of, you turn on the TV and see all of the, the words. I was thinking about the words epic proportions, worldwide global crisis, and you hear the language of the pandemic, and it's really overwhelming. And then you close off the TV and sit down and do your work or do whatever you're supposed to do. In isolation or in aloneness. And I think for a lot of people, that's really, really hard to put these two things together.
We're also not in a point in our history. I was having this conversation with Dr. Niemeyer a couple of days ago. For at least here in the United States, I'm sure for Canada, we're very much used to and fought for our liberty. So liberty, freedom to do things is very, very important to us, as I'm sure a lot of people around the world. So the sense of not having that liberty and not having that freedom, and we're very much exercising that. And
right,
we're at a point in time in our history where maybe during the pioneer days or something, people were used to staying in there. They would go to town and come back and stay in their cabins and just be on the farm. But we're not used to that. We're
so it's interesting. I was just reading it.
Go ahead.
Well, and I was just reading an article about that as well, talking about some of the Asian countries that are used to having a little bit more structure in terms of their society and having more governmental regulation and regimentation, but these are actually societies that have done quite well quarantining and maintaining the health of the population, because they give a dictation, that you don't go out, and they don't. And we're not used to being told by an outside force that you can't do this anymore. We value our independence, and we treasure this. It's part of who we are. That's that loss of that sense of identity and my own sense of purpose. So and then to not really know. There's also the criticisms of how political organizations or political figures are handling or not handling, and there's a lot of confusion for people in terms of what are we really looking at right now. I think that's really difficult too.
Yeah, yeah. So how do you cope with non-death losses? Like, what would you say to the audience? I know there's a lot of them we're talking about, but when you're working with people, what are some of the approaches you take to approach these losses, and maybe some that have resulted from the pandemic?
I agree. I think, Bob Niemeyer mentioned about how it's important to be able to acknowledge the losses and to name them. And I agree with that. Actually, the first book I put out on non-death loss was called Counting Our Losses. And it's not so that we go, oh my God, this is really bad. It's more that, okay, you look at it on paper and say, that makes sense. That's why I'm feeling the way I'm feeling. And so it's a way of validating, I'm really feeling these things. And I'm really experiencing these losses, and they're very real. And then to be able to work with those in ways that are congruent with yourself. So, some people might find that it's helpful to journal, and some people might find it's helpful to do a Zoom call with another friend or somebody else that they know, and to reach out in these ways. And to find ways that you kind of start focusing and working through in the same way that you would do the grief with someone who's lost a loved one. You sit down and think about the story that's involved here. Who am I, and how am I now versus how I was then? How is my world different now? Will I be able to go back? And so I think it's looking and counting those experiences for their significance to us. And it's really helpful if we can come up with our own rituals. I know I do a lot of sand tray work, and sometimes I'll do some work with that. My daughter has recently, she's drawn some things that have been really interesting. That's how she's kind of gotten it out. One thing I will say, and I don't know if you're experiencing this, but there's a real, you could be overwhelmed by all the self-help stuff that's coming through right now too. My inbox is getting filled with all sorts of stuff, but probably 20 things a day about how to handle anxiety, how to deal with the pandemic, being mindful, dealing with anxiety. That's almost overwhelming in and of itself as well. So I think one of the strategies, I do some work with a couple of my clients right now online, is to decide how much exposure you need to this stuff and how much you don't. And sometimes people find the tipping point happened about 10 minutes before they turned off the TV, or the tipping point came after they read 20 emails and then they went on to 50. So, to be aware of your really real limits for taking in this kind of information, so you don't add to this pile of overwhelm. Because I think the overwhelm is big for people right now, and it paralyzes us. And when we're paralyzed, we're feeling anxious, it's really hard then to work it through. One thing I think this is really important is that, we're focused on grief, it's ADEC, but we'd be remiss to not talk about trauma in the midst of all of this as well. That, when you talk about assumptions being absolutely shattered and lives being changed in ways that you could never go back to the way you were, you're dealing with a significant amount of trauma overlay, as well as, the grief. And I think you really need to be aware of grounding and of understanding the role of your body and how to handle when you're in that place of being overwhelmed, that you're not sleeping well, that you're really anxiously vigilant, and to the point that you cannot focus. Then I think it's really time to not sit down to the counting the losses. It's time to start counting breaths, and to really engage in some just basic grounding exercises so that you can come back to yourself. I'm here. That's one of the things one of my clients says, I'm here. I have not transported somewhere. I'm absolutely here. The floor is still here. I'm still seeing this, and to come back to the room in a way that reminds you that, okay, this is all here and I'm still here. The world still goes on. The sun comes up and the sun goes down.
Mm-hmm.
Psychoeducation is not a bad thing either. If you look at some of the history of the Great Depression and even the recession from 2008 and 9, that people financially bounced back afterwards, quite well. The remaining trauma stuff and the remaining after effects emotionally were harder for them to overcome than the actual getting back to normal in terms of their financial stability or, you know, what life had to offer for them. So sometimes you have to feel like you're safe and you get to that point, and then you can start doing some of the grief pieces that come when you start feeling more grounded and safe.
So Darcy, it's really important to talk about that psychoeducation. So in CBT language, Dr. Judy Beck often talks about, you know, the evidence and the data. So we use that in cognitive psychology a lot all the time. So you're saying maybe possibly using that psychoeducation with your clients to talk about, you know, how people manage through the Great Depression, how people manage through the recessions of 2007, 2008, because it's a very valuable to kind of for people to analyze the data. What does that do for people, you think?
We've been through this before. So, I mean, humanity has been through one pandemic after another, one infectious spread after another, and we've always come through. This generation and the generations before, no, this is a new experience, you know, for like my daughter coming up. She doesn't remember SARS. H1N1 was not that significant in terms of what we're going through right now. So I can remember, you know, being told to prepare for pandemic. I was serving on the board of one of our hospitals, and they were doing pandemic planning, and it was something out there, you know, it was abstract. But now that it's here and you start looking at when we had to deal with other epidemics and pandemics, that, you know, we get through. And a basic response to all these traumas and, you know, this really difficult time in our lives is usually resilience. So to remind ourselves that, you know, as a species and in terms of humanity, we've been through this. And actually, what part of coming through this is that our grief response has come with us. That we think of grief as an instinctually programmed response to loss and to these situations where we have to regroup and rebuild, you know, a way of being in the world. And that's a part of what has come with us over evolution and time as well. It serves us well.
I'm wondering, Darcy, if you could comment, when we talk about the kind of breaking or the destruction of the assumptive world and then resilience, a kind of a remaking or rebuilding response to that. So would you say is resilience more about foregoing an assumptive world and living in a place where you just try not to make assumptions about the world that you live in? Or is it about rebuilding a different type of assumption or rebuilding new assumptions about the world that you live in? When it comes to the assumptive world, what does resilience look like for that?
I don't think there's a world that we can live in where there's no assumptions. I think even we say I don't have any expectations or assumptions, that's an expectation or an assumption. So I think resilience in our assumptive world means that I now have a way of incorporating what has just happened into how I see the world so that I can move forward again. So it's like after the death of a loved one, I have to find a way to live my life and build my assumptions about who I am and how the world works without that person in my life. And the same thing right now in terms of my, you know, maybe my retirement savings and my plans for the future. And so that's completely changed from what it might have been 3 months ago. And so my new assumptive world is going to incorporate that unexpected things do happen. And that, number one, I made it through, and number two, I've got to come up with a way of dealing with that. So the new assumptions might be, you know, bad things can happen, and I can get through it. One of the things my clients have often said, who've been through a lot of things before they've come to see me, I love this. I'm going to be okay, but I don't have a clue what okay looks like. That's kind of that feeling. And so the resilience piece is, you know, here we go again. My world's been shattered. The world, you know, my world's in smithereens. I don't know what I'm going to put together next. I don't know how I'm going to do this. But I've seen this before in the past, and I've come through stuff that I never thought I could make it through before. So maybe the thing that got me through before is the thing that's going to get me through now. The hard part will be, and what I'm reading about a lot now, are the inequities and the people who are marginalized and don't have access to basic resources. And these are the people that are going to be disproportionately affected by the non-death loss experiences and by what's happening with the pandemic at this point in time. I think, you think of coping strategies for people going through traumatic experiences. If you look at the work of Bonanno and his associates, the typical response to traumatic events is resilience, is the ability to absorb it, somehow make sense or make meaning from it, and find a way to move forward in life, taking that with you. But there's a process involved you have to go through to get to that point. And I tend to think the grieving process is, the reason it followed us through evolution is because it helps us, because it's that grief is, I think, the process that makes us step back and to reflect on what's most important, and to strip away the chaff and to really get down to what matters the most to me. And then somehow life has more meaning afterward because I've been able to do that process. And I also see my own strength as I've gone through that process.
Darcy, I often teach my students, it's a survival instinct within us to be resilient and I talk to my students when I teach my grief counseling class. People somehow, humankind has learned to live with loss, thrive with loss, grow through loss. Look around you. People have been dying and change has happened since the dawn of humankind. So somehow we wouldn't be here if people were not living through pandemics and surviving them and rebuilding and making meaning.
If we weren't somehow resilient as a species to start with, right?
Exactly.
But as individual people, I think there are protective factors that might be harder right now. And that, some of the coping mechanisms, I think of going out for drinks with the girls, or being able to go join a group. And some of the groups are converted to Zoom meetings, but it's not the same. And so I think there are things that people would normally do to cope that are not available to them now as they might have been at other times. So that's where we have to get more creative.
Yeah, because the reframe on that could be, if this had happened in the 1970s and I was growing up in New York, we wouldn't have Zoom to be able to talk to each other and host virtual bingo and host online classes for our students, right?
Yeah.
So,
yeah.
We do have to also look at those things as well too.
It's the reframing part as well, but it's not to negate the impact right now. And I think of the loss of living our lives. One of the things that comes to me is our university had to cancel convocation for our graduating students. And I had a couple of students come up to me and say, it's not like we don't want to whine, because there are people dying. There are people working as healthcare workers in the hospitals right now who are putting their lives on the line and who are in there doing this work. And so for us to lose grad is sort of we feel like it's a small thing. And I said, but it's something you'd always thought about, right? And you'd always planned, this is what's going to happen. This is going to be ending your university with your friends and classmates and say goodbye to your faculty and teachers. And one of them looked at me and she had tears and she said, but I don't feel like I can say it because it feels so small compared to what other people are facing right now. And I said, but to you, it's not small. So that's where we go back to that conversation about comparing grief. Daughter is in 12th grade. So this is her prom year. And back in the beginning of the year, she picked out her dress. It's this gorgeous dress. It came, it's absolutely drop dead beautiful on her. She was trying it on the other day and she looked at me and she said, I'm not going to get to wear this, am I? And she said, Mom, this was my prom. And I felt that sense of, I'd always wondered what her prom would be like and what things would be like for her when she goes through grade 12 and, she's looking to her future. And this is certainly not anywhere near what she had planned either. So it's not to diminish that there are some losses, you don't compare them. I mean, it's just for her, this was a big loss and this was a rite of passage. And the same thing for my students who now aren't going to ever set foot in a classroom again before they finish out and get their degree. I'll never set another foot in the classroom, never be in a room with their classmates or their teachers, and they won't be walking across the platform to get their diplomas. And for them, this is a big thing. But I would never put that in context with somebody whose loved one is in the ICU right now on a ventilator. And their grief is very real as well. But that doesn't diminish the grief of somebody else who's experiencing these losses, because it's like I said in the beginning, it's a subjective appraisal of what's been lost and what you do with that.
I often talk to my groups, my bereavement groups, about some of the things, the group rules we have is we don't engage in the grief Olympics. So, comparison.
Yeah, exactly.
So, attuning yourself to the losses of your clients, attuning yourself to the losses of others and appraising those losses and making sure you're validating and empathizing with them, because that's what we just talked about right before us. We had Dr. Ken Doka on talking about disenfranchised grief. What ways can we enfranchise some of the losses that people are experiencing right now without minimizing them? That doesn't mean we can't do help people reframe or help people find new meaning or try to find positive coping strategies, but we have to definitely acknowledge and validate those losses so that we're not disenfranchising them for folks.
Right, and I think that's a big piece, is if we start trying to compare this to that, or my experience to your experience, we've missed the point, because the point isn't about a shared assumptive world as much as it is my assumptive world. I think we do have collective grief. I think that's actually something that makes this situation very unique, is that we're grieving collectively, which means we can share collectively with that grief in the ways that are possible. We experience some of this also individually in terms of our unique situations and circumstances. My daughter, for instance, looking to get a job or looking to go into university next year, and we don't even know what that's going to look like, versus me hitting a place where I'm thinking about, will I get to retire before I'm 90? So it's trying to, all of us are dealing with this piece of uncertainty. And one of the assumptions I think we especially in this society are, that you make your future, you build yourself up, you pull yourself up by your bootstraps. If you work hard, you'll be rewarded. If you're out there and doing what's right, then good things will come to you. And that's not always true. And so for a lot of people, this doesn't make sense in their assumptive world, that I'm doing everything I should have been doing. I've lined up the way I should have. I've made savings. I've done this. And so, the assumptions we made about what life was going to be like because we did all the right things, and to think it doesn't matter is huge. And we're trying to find meaning in that piece is going to be a big process for a lot of us, I think.
There are going to be disparities. I mean, people have access to healthcare, people who have lost their jobs or haven't lost their jobs, people who have access. I was just listening to this yesterday. I think it was on one of the news channels. Might have been like, I think I watch World News Tonight every night, about people that live in rural counties now that are about 100 miles away from a hospital. And I think Dr. Burks here said if you're 100 miles away from a hospital, you're typically going to be 100 miles away from a testing center. So,
Right.
There are huge disparities. And we can talk about disparities in families. Even in my own family, my sister's in the travel business. My aunt she has lost income and may lose their business now, where I'm in the mental health field. And for me, business has actually been stable and picked up. And so, things where we both worked really hard in life, there may be total financial inequity in all of this, just within, I use that as an example to say within families. So, I mean, looking at possibly losing a business that they've built up for 30 plus years. So, all those losses for each family and individual are going to be, like you said, very subjective.
That's right. And so I think we've all made these certain plans, and we've all had, certain arrangements. I think about how in the world do something like the travel agencies, the travel and tourism industry, the restaurant, and how do these places, how will they even begin to recover back? The domino effect is so big, right? And it will happen, but it will all look different than it has in the past. I remember after the events of September 11th, 2001, and airplanes were empty, right? If you remember that. I remember I was flying on a plane a couple weeks after the events happened. I was the only person on a 737. That was it. I was it, alone. Because people were afraid, and it was a huge hit to the airline industry as well. And they've survived. So it's a hard one to consider the huge impact because that's a company. We invest in companies. Companies employ people. We depend upon all of this for, you know, our livelihoods and our planning, and also for stability in our societies. So this is going to be hard to see where we're going to land and how we're going to land afterwards.
I think it's a key point you bring up, is that it's right now what's generating these potential losses that we don't know if they're going to happen or not. All that projective thinking. So how do you help people manage that?
Oh, I go back to this. It's a quote by Mark Twain. He says, "I've seen some horrible things in my life, and some of them actually happened." You know, I always go back to that because our minds are trying to prepare us, you know. And so it's in that situation that our minds try to prepare us for the worst case scenario so that we're prepared. That's kind of a part of our tricky brain, we call it. And we have to actually kind of take it over and say, okay, that's not helpful. And to recognize when the train starts taking off and we need to somehow be able to settle it down. I really like compassion focused therapy has a really nice diagram that looks at kind of our basic emotion regulation systems. And one of them is the threat system. It's bright red, you know, and we sense a threat. It's like, you know, we pull into ourselves, we go for safety. It's the fight flight stuff. And then another drive is, you know, survival and to be able to have our needs met. And so both of these are really in play right now. But a third area is our soothing area and our ability to find places of safety and our ability to find places of groundedness, because that balances us out. We need to access all three parts, our drive system, our threat system, but also our safety seeking and soothing system. And to be able to find ways to tap into that so that we kind of take that step back and say, this is happening, but I can take a step back from this. I have the ability to do that. Or even in the midst of looking at the Dow Jones or whatever's happening, in this moment, I'm safe. In this moment, I'm here. And to find the ways that actually help us to do that so that we're better equipped to then, you know, address those threat drive systems that are important. They're important for our survival, but they can also take off and not balance us in ways without that soothing system somehow being engaged. So I look at it that way when I'm working with clients. I'm trying to kind of see where they are in terms of these three systems so that I can help them to balance these things out a little bit, because that's when we can kind of choose how we want to be, which is that piece of, I may not be able to control what's happening around me, but I'm controlling how I choose to respond in this moment. And so those are the places that we can control, because if it's outside of us, I can't control the weather. I can't control people's emotions. I can't control the seasons. You know, that's all changing because life is all about changing and impermanence. I can control how I want to be with these things and the conscious choices that I can make with them. So that's where I find, they call it the 3 circles approach, but that's where I find to be very helpful, looking at situations like this that can be so huge and so overwhelming from a perspective of more balance and groundedness.
That's a great summary and a great actually model to kind of follow. And people who have had sudden loss, and this is very much a lot sudden loss that is happening. I often will say to people, they didn't know what, you know, when a sudden loss happens, you didn't know where you would be 3 months ago, that you would be in this position now. So you don't know necessarily what's going to be. I get them to kind of think back upon where they were 3 months ago. It was totally different from when they are here today. So,
but you can also take that to really work with people and say, who were you 10 years ago? Are you the same person that you were then? Are you the same person that you were 5 years ago? Because most of us aren't. So we're constantly, we don't see it, we don't recognize it because it's our own appraisal. But when I look back and think, I'm not even the same person I was 2 years ago. So I'm not going to be the same person I am maybe in 6 months, but I'm here, you know, so I show up for it and I'm here. I've survived all of this change. I've survived all of my own evolution and growth. That doesn't mean any different that now I will still continue on as I change and grow and have to adjust to all sorts of things. I've done it up to this point, and I will do it again. Not necessarily happily sometimes, and I always say kicking and screaming at other times, but I show up and I get there. And I think we do.
That's right. I don't know if our 20-year-old selves would have been able to predict that we'd be on an ADEC webinar talking about this pandemic right now. So
oh, heavens no, heavens no.
So be careful about your ability to predict things.
But it's a key because we like predictability, you know, and we've had this illusion of life being predictable or life being controllable, or we're not changeable, and none of those things are really real. So that's all been kind of an illusion. So what is real? That life is about change and challenge and threat and growth. And that is the dynamic part of living in a place that's impermanent, and surviving through and then thriving forward. I think that's part of who we are as human beings and part of being in this earth.
And the thread of a lot of what you're saying is going back to a saying, an old saying that comes out of AA, one day at a time.
Yeah. I love the serenity prayer.
Yeah, that's going to be used a lot through this, is that I love how you kind of weaved in the need that we need to really be exceptionally mindful right now, grounded in our experiences, and really kind of live more day to day, moment to moment.
Yeah, that's true. So yeah, that's a nutshell.
Well, thank you so much, Dr. Harris, for being with us here today, talking about COVID and non-death loss, and a lot of other really interesting aspects around non-death loss, and just the loss of our lives in the assumptive world, and also our ability to move forward through loss and be resilient through loss, but also attune to our losses and acknowledge them. I want to just mention that Dr. Darcy Harris will be doing a webinar on Tuesday, April 10th. So I'm used to calling you Darcy, so I'm not used to being.
It's fine with me.
Darcy will be doing a webinar for ADEC on Tuesday, April 21st, Grieving the Loss of Living Our Lives. We're really excited about that, Darcy. And it will be a follow-on more to this conversation here today. So
thank you.
Thank you very much for joining us here today, taking time out of your very busy life and your schedule. And, you know, also continually talking about loss, which can be overwhelming to us who work in the field too. So I want to thank you for taking the time to do that with us here today. So
thank you, Jill. Thanks for having me. I wish you well.
You too, all the way in London, Ontario, Canada. It wouldn't be all the way for other people, but we hope that you stay safe, stay well, practice your physical distancing, and everybody in the audience, please stay safe and stay well. On behalf of ADEC, thank you for tuning in today.